The next video will show you how to obtain a blood sample in preparation for running a blood glucose test.
Before obtaining a blood sample, it's very important to wash and rinse your hands in warm water and dry your hands thoroughly. This reduces the risk of inaccuracy caused by contamination. To obtain a blood sample, you'll need an Agamatrix lancing device and an Agamatrix ultra-thin lancet. First, remove the grey cap by a simple anti-clockwise twist motion. Using a new lancet every time, insert firmly into the lancet holder until it comes to a stop, and press the release button to expose more of the lancet. Hold the lancing device and lancet firmly in place with one hand. Use your other hand to twist off the lancet cover. Do not discard the cover. You may want to recover the lancet for safety after use. Replace the lancing device cap by twisting it clockwise. The lancing device offers 5 depth settings. The small dot is the shallowest setting and the large dot is the deepest. If you haven't lanced before, it's recommended that you set it in the middle on the 3rd dot. Pull the cocking handle out until it comes to a stop. This primes the lancing device. The lancing device is now ready to use, and the cocking handle indicator located in the centre of the release button will now appear red. When choosing the site on your fingers that you're going to lance, opt for the sides of the finger. There are less nerve endings here than on the pads of your fingers. Do not use your thumb or forefinger. Press the lancing device gently against the chosen site and press the blue release button. To encourage the blood drop to form, squeeze from the base of your finger up towards the tip until a small drop forms. Do not squeeze directly around the lanced area, as this can change the composition of your blood sample and result in an inaccurate reading. If you have access to a sharps bin, expel the lancet from the device directly into the bin by pressing down on the grey ejector button. If there is no sharps bin available, place the original cap upside down on a hard surface. Bring the lancing device down and press until you hear a click. The lancet is now safely recovered and you can remove without the risk of injury. Dispose of all used lancets in accordance with your local authority's guidelines. If you're struggling to get a blood sample, try using warmer water when washing your hands. This can improve circulation. Alternatively, increase the depth setting on the lancing device.
The next video will show you how to run a blood glucose test.
Insert a test strip into the test strip port of the meter with the contact bars facing up. The meter is now ready to test and will display this animation. Obtain a blood sample using the Agamatrix lancing device. Bring the tip of the test strip down vertically to gently touch the blood droplet on your finger. When you hear a beep and the visual window fills, pull the meter and strip away from the blood sample by raising the meter. The meter will start to calculate your blood glucose level and the display will count up 1, 2, 3. After several seconds, you will see your blood glucose reading.